St. Agnes Hospital, of course, is just a few miles west of our University of Maryland Medical Center in the West Baltimore area. And what happened in this state in 2014 was, with the Affordable Care Act, there became a major new focus on not just providing great health care, but managing the health of populations. And there's a term that's used frequently called population health. Not just being concerned with cranking up more admissions and surgeries, but actually managing the health of a population, particularly those with chronic diseases. If you look at West Baltimore, sadly the same is true in East Baltimore, some of the sickest zip codes in the United States are in West Baltimore in terms of the number of admissions per thousand residents. And what it says is chronic disease, heart disease, other diseases are very prevalent there. Well, we share that piece of geography with St. Agnes. So St. Agnes, a very capable hospital, many of those physicians are University of Maryland medical school graduates or resident trainees. We know the St. Agnes folks very, very well. We came together with them and we said, listen, let's work together in West Baltimore to elevate the health status of that population. And then we said, but we should also be sharing other resources. We should be sharing the medical expertise of the medical center and trying to come together wherever we can. St. Agnes Hospital is owned by the largest Catholic healthcare system in the United States called Ascension Health out of St. Louis. And so they are the only, St. Agnes is the only hospital that they own here in Maryland, which is a very complex and highly competitive market. So they felt partnering with a large system like ours would allow them to competitively be stronger, but also share resources. But most importantly, we would come together, and we have in a pretty successful way, to really improve the health status of West Baltimore residents as they move around in the healthcare delivery system. So it's been a great, it's a clinical partnership, and it's expanding, so it's great stuff. What's happening out across the healthcare system is organizations like ours, which are were focused exclusively on healthcare delivery, more and more are being asked not just to deliver great healthcare, but to manage the health of populations. And so we looked at that and said, if that's where the world is going, and the Maryland rate setting system is clearly taking us there with this new what we call Medicare waiver that came out of the Affordable Care Act, where we're being asked to keep people out of the hospital, to invest in their health, avoid readmissions, do the things that get the patient to the lowest cost setting, which is really managing care. And we said, if we're going to manage care, then we ought to move up what we call the premium food chain towards a higher part of it, and actually accept risk with, take the premium in, accept the risk that goes with it to manage that care. It wasn't our core competence. We're healthcare, we're delivery people, we're hospital people, doctors, those kind of things. We're not insurers. So we said we need to go out and find that expertise. And we found it here in a locally managed and run health insurance organization called Riverside Health. They had a Medicaid managed care organization, had about, now it's close to 40,000 Medicaid lives. And we said, this became a build or buy decision for us. We could try to build that capability. It's not our core competence, or we could try to acquire it. And we decided it was better and faster and give us a better chance for success to acquire it. We knew the CEO, a very capable guy called Mark Puente. And so we went to Mark and said, how about joining our organization? And we have very successfully brought Riverside into the University of Maryland medical system. And since then, we've added a Medicare product called a Medicare Advantage product, which is a managed care product in the Medicare space. So we have a Medicaid space, and we have a Medicare space. And we've also created something called a quality care network of physicians. We now have about 250 community physicians in a network where we're now reaching out to some of the commercial carriers about managing risk and taking responsibility for the care of their patients. New venture, but so far so good.